relying on checklists without asking why, without asking how, without leaning on your nursing process or using other skills that you learned that seasoned nurses have developed. The number one thing that it takes to be successful as a new grad nurse is to grow your skills of critical thinking and clinical judgment. If you're a brand new nurse and you feel like a fish out of water and you feel like you're struggling most days, I see you, I hear you, I am you, and I have been in your shoes. And this video, my friend, is for you. So I'm going to share 6 ways to start growing your critical thinking and your clinical judgment. Because at this point in your career, you've passed school, you've passed your NCLEX, you have that RN behind your name, and you're through your orientation phase, and now you're on your own. And holy crap, some days it feels like drinking water out of a fire hose. And what I want to share with you from my heart is I actually burned out and I left the profession for 5 years. But the year before I left, I went into a desk job. I went into the quality management position and I was removed from the bedside. So when I came back into nursing after 6 years of being away from the bedside, I went back into an emergency room. And I kid you not, in so many ways, I felt just like a brand new graduate nurse. There was so much that I hadn't done or hadn't thought of in so long that I felt overwhelmed. I felt new. I felt like my critical thinking and my clinical judgment was a little bit rusty. And I know exactly how you feel because I've been there. And not only when I started my career, but more recently when I came back after being away from bedside for 6 years. So I want to share with you 6 ways that you can lean into the growth process without judgment and start growing those critical thinking skills. Now, I also share this from a place of like, we are at a time in nursing where when the electronic medical record was developed, it's been helpful because it's turned nursing into a bit of a checklist process so that we don't miss anything. But I feel like the major drawback of that is that it's stealing your ability to think critically because you're relying on checklists without asking why, without asking how, without leaning on your nursing process or using other skills that you learned that seasoned nurses have developed. Because I come from a generation in which there was no such thing as an electronic medical record. We didn't have checklists. We had standardized paper charts and a lot of handwritten notes, and we had to rely on our critical thinking. So we grew it naturally, whereas you are going to have to grow it intentionally. Okay. So 6 tips on growing critical thinking and clinical judgment. Number 1, ask why all the time, all day long. Don't just do the task. Don't just check the box because the box needs to be checked. Ask why you're doing it. Ask why is it necessary? Ask yourself, if I did do this, what could go wrong? And how could I recognize a problem early that the checkbox can't prepare me for or make me think about? Like, there's just no way that a checkbox could notify you of what could potentially go wrong based on your individualized patient. And when something confuses you or doesn't make sense, look it up. Use a reliable resource like UpToDate or Lippincott or Medscape or textbooks, or call your educator, or like I often use the LexiComp. It's like a little drug book like on my screen that I can reference for medications and to remind myself, like, is this compatible? How slowly should I give it? Do I need to dilute it? Like, those are things that I lost in my 6 years away from bedside that I constantly have to be relearning, reminding myself. And what I want you to know is that even after 20 years of being in the profession, I still don't know things. Every day, all day, there are things that I just don't know, or I don't know well enough to feel like following through with the action is the best choice for my patient. So I'm constantly like searching with my resources or looking things up and asking myself, why? And is this the right thing? And what could go wrong? And how do I be the very safest nurse I can be? So take those advantages for in the moment asking why. And I'll share with you a very recent example. I had a patient come in with a blood pressure of 60/40, like critically low, with a MAP. I think his MAP was like 50 or 52, something like that. And the pharmacist or the physician put in an order to start norepinephrine. And when I scanned the bag said 4 milligrams and 250 mLs, but the order said 8 milligrams and 500 mLs. And I said, well, it's just half. So like it does match kind of, but the math isn't mathing. So I started the drip at the rate I knew I needed to start it at. And then I called the pharmacist and I said, hey, something in this system like doesn't make sense. Like it let me scan the bag, but the order says 8 and the bag says 4, but the concentration matches. It's like I'm so confused right now. And the pharmacist said, oh my God, I actually put that in wrong. Let me go and correct that. So there was an error on her side. And when I kept asking, like, this doesn't make sense. Like, why doesn't this make sense? Why can't I reconcile this in my brain? Like, why don't I feel comfortable and confident about this specific process? It prompted me to ask why. It prompted me to call my resources. And sometimes my resources explain it to me and I'm like, oh, I just missed that. Like, thank you for helping me. And sometimes they're like, oh, I made a mistake. Thank you for calling me. So it's never, ever, ever a mistake to ask why and to lean on your resources. Number 2, use your nursing process. They gave you the process of assessment, diagnosis, planning, implementation, and re-evaluation for a reason. It's a very foundational, very simple way in which to approach nursing, and it actually enhances your clinical decision making in the moment because it's in that initial assessment and the implementation and the reevaluation that you get that information, that feedback from your patient's responses to the care that you're giving. And does your systematic thinking align with what the physician is ordering? And if your systematic thinking, like your nursing assessment, your nursing diagnosis, your planning, implementation of orders, and evaluation, if those two things don't match, that's your indication to ask, why don't they match? What am I missing? What is the physician seeing that I'm not seeing? And go have that conversation before you implement that care. Like allow that process to guide your decision making and to guide the questions in which you ask. Remember, it's a very simple, systematic way to approach your patient that supports you in continuing to develop that clinical decision making. Step 3, which personally is my favorite, learn from senior nurses. Observe what they do. Ask them questions about why they do things the way that they do things. Debrief with the nurse who understands how they're making the decisions, how here. I often tell my new grads when I'm training them, like when you feel overwhelmed, because you will, I want you to expect to feel overwhelmed. You need to lean into the senior nurses in the department. Like I remember when I was very first getting back into nursing after 6 years away from the bedside, I had gotten to a point where I had 5 patients. All of them had come within a 45-minute time period. I didn't even know who was in like 2 of my rooms. And I felt so overwhelmed. Like I didn't even know where to start. Like there were so many things to do that I got overwhelmed and I just had to like pause, take a deep breath, go to my charge nurse and say, hey, I'm super overwhelmed right now and I need your help prioritizing. Like based on what you see, where should I start? What's my next best step? And just being able to like hear that feedback of like, okay, this and this, ready, go. It set me on a path to like reset myself, re-engage, and reprioritize. And now I'm able to teach my students and my new nurses how to leverage senior staff to help them get back on track. And one of the tools that I share with them is actually number 4, growing your clinical judgment and your critical thinking skills, is use your tools for communication and prioritization. Now, I work in the emergency room. So my job is airway, breathing, circulation in that order on every single patient, every single time. If I don't know where to start, I start with airway, breathing, circulation. Do any of my patients have an airway issue? Are all of my patients breathing the way they should be? Are all of them circulating their blood the way they should be? If not, that's the patient that I start with. It's a very simple ABC to help me get back on track to prioritizing which of those patients that just came in the last 45 minutes needs my attention first. It's a constant game of prioritizing and reprioritizing. Using your ABCs is a very simple way of getting yourself back on track. Also, using the SBAR, right? The situation, background, assessment, and recommendation tool helps you organize your thoughts. It helps you get back on track of like, okay, I just got 5 patients in the last 45 minutes. What's their situation? What's the background? What is my assessment telling me? And what is the physician recommending that I do about it? Or what does my clinical judgment and my nursing diagnosis and my planning indicate that I should do about it? What's that recommendation? And that really helps you. Just the SBAR helps you get back on track with your thinking. Now, I have this great little tool on my badge. It's literally, what's right here? Literally the SBAR, in case I'm like in a pickle and feeling overwhelmed and forget what the B means, right? I know SBAR is a great tool, but what does the B mean again? Like, what do I need to do? And it tells me right here, like I keep it on my person in case I get overwhelmed so that I have the simple reminder of how to get myself back on track. It's like setting myself up for success, right? Tip number 5, collaborate and clarify to help yourself think ahead. Nursing is a constant game, especially ER nursing, is a constant game of thinking ahead. What is likely to happen if I do this step? What might happen next if I don't do this step? What complications might happen? What outcome am I expecting? And that's part of any implementation. As you're about to give a medication, about to do a procedure, your responsibility in that is to think ahead. What is my expected outcome and what complications could arise because of the action that I'm taking right now? So collaborate with your educator, with your charge nurse, with that seasoned nurse. Ask why. If there are any steps in the process that aren't clear to you that you don't feel masterful with. Another great example is when I came back into nursing, like my second or third shift, I needed to access a port. Y'all, it had been probably 6.5 years since I had accessed the port or even reviewed sterile process or procedures on accessing a port. So I pulled up the policy, I read through the evidence-based practice steps to refresh myself, and then I asked a seasoned nurse to come be at the bedside with me as I went through the steps to make sure that I didn't forget something important. Okay, that was me saying, I need your collaboration because I'm not feeling confident about completing this skill independently and safely. Like, I don't want to give this patient a central line infection because I'm prideful and didn't want to ask for help or clarify. That's dangerous. The second that you start practicing nursing and you're uncertain of the steps, you don't know why, you're not sure, and you don't ask for collaboration, that's the second that you become dangerous. Let me just lay it out there right now. Like, let's not be confused. That's dangerous nursing. The end. Ask the questions, collaborate, clarify, think ahead. This is your job as a nurse to develop these skills of critical thinking and to not be afraid to reach out, to use your resources. Do your diligence before you take action, because everything you do or do not do for that patient is going to have an outcome. It's going to be either good or it's going to be bad, depending on how you approach it. And that's the responsibility of having that RN behind your name. And remember, when patients come to the hospital, they are literally putting their lives in your hands, and they are depending on your clinical judgment, and they are depending on you to use that critical thinking every single step of the way. Call your pharmacists, call the doctor, call the therapist, ask another nurse, ask your charge nurse to help you understand the bigger picture before you act. And last but not least, set weekly learning goals. Learn the difference between normal and abnormal vital signs of all different ages, of the labs, of the signs and symptoms that you can detect that signal a change, a deterioration, an improvement in your patient. Now, this badge, you'll notice that like I might win the award for most badge buddies, right? I've been a nurse for 6 years, but here's the thing. Sometimes I need a reminder. Does the blue top go? The red top go first? I can't remember because I don't use the red top nearly as often. I need a reference to help me remind me of my blood draw. I work in adults and I work in pediatrics. So I have my pediatric vital signs badge buddy so that I know if I'm dealing with a neonate, here's what's expected. I know if I'm dealing with a school age child, here's what's expected. Here's what's expected for a toddler. I don't have these memorized. These are constant learning opportunities for me in the current season of my practice. And these are the things that like I need constant reminder for, but I need quick access to it. So I ask for a badge buddy. We also have a computer system that does not automatically change feet and inches to centimeters, and we go in centimeters for height. So when I ask the patient, how tall are you? I whip out my badge buddy and I find how tall they are in feet and inches, and it tells me right here what the conversion is for centimeters so that I can do my job more effectively, leveraging the tools that I have in my pocket. I also have conversions between Celsius and Fahrenheit because we use Celsius, and sometimes our thermometers don't translate, or another staff member will write down the temperature in Fahrenheit and I'll need to convert to Celsius rather than doing another temperature. So I have these resources on me at all times because I know my weaknesses. I know my opportunities for learning, and I want to have the resources to take competent care of my patients at any given time. The last tip for that with like setting weekly learning goals is choose one topic per week, like heart failure or electrolyte imbalances or medication reconciliation, like whatever skill or condition that you're seeing a lot of that you don't feel confident in yet. It still challenges you. You don't feel like you're in a good groove with it. Take it upon yourself to just get curious. Go learn more about it so that when you come back to work, you're feeling more confident, you're feeling more comfortable, you have more resources in your mind to pull from as you're critically thinking, as you're applying that clinical judgment in the moment. Now, here's something else I want to share with you. You will die before you learn everything there is to know about nursing. The end. So when you can commit yourself to that fact and choose to be a lifelong learner and recognize the things that are uncomfortable for you that you don't feel like is second nature yet, and just dedicate yourself to becoming masterful at each of those scenarios, it's going to lead to a future where not only are you a confident, competent, independent, and masterful nurse, but now you're an incredible asset for the department. Like you can support the next generation, or you can support your fellow new nurse who might be struggling, or you can support the OG like me who went on hiatus and came back. And now I'm feeling like a fish out of water. Like you get to be that for me because you've chosen to grow your critical thinking. You have chosen to dedicate yourself to that clinical judgment and to growing your knowledge base and to knowing which tools might be helpful for a nurse who's struggling with some basic things and needs a reference on their person, right? So I can't stress this enough. Growing your critical thinking and your clinical judgment is the one thing that is most required of you to become confident, competent, independent, and masterful as a nurse for your department and for your patients. I hope this was helpful. Until the next perfect time, much love.